This series of exercises are designed to strengthen the hip. For this exercise series, you'll need a door anchor, place it at the high anchor, and then you also need an ankle cuff. So to begin, I would suggest you start with your non-dominant leg. In my case, it's my left leg. Or if you have an injured leg, for example, you've had a total hip replacement or a strain to the muscle, you've torn a muscle, whether it's the hamstring, the hip flexor, I would suggest that you start with that leg first because it's going to determine how many repetitions you get on the other side, because what we're trying to do is create symmetry and balance from left to right. And so that's going to be an important thing for you to do, is start with your weak side, and then you only do that many reps on the strong side. All right, so for this particular one, to start, you're going to get, if you have an elevated platform, that's a little bit better. If you're flat on the floor, it's okay as well, but you will just slide back a little bit, and you want to make sure that the tension you have on the band is going to be challenging enough that it's not going to be overly easy to bring your foot all the way down to the ground. And so you will lie back and go into that single leg bridge. From here, just start by bringing that heel straight down to the ground, always in control, not letting the resistance slingshot you back up. So I don't want to see that. I want to see nice control through that whole movement, exhaling every time you push down. And you can do anywhere from 10 to 20 reps. I typically like to do 20 reps to really get the muscle nice and warm. 10 just doesn't seem to cut it, especially when you're trying to warm something up. It takes a little bit longer than 10 reps. But you go at your own pace, depending on what level you're at, and always move within your pain-free range of motion. So don't try to go any further than you can tolerate. Certainly if you have an injury or an old injury, it might actually be a little bit tender when you initiate this movement if there's scar tissue in the area. So just work within your pain-free range of motion. Once you've completed 20, you turn to your side. You can adjust the ankle cuffs so that it's turning with you. And here you're going to work the outer thigh muscle. So you'll go into your side plank and you're just going to bring that leg up and down. Nice and controlled. You can come through here to really stretch out the body. And the big thing, like I mentioned at the outset, is to really start to pay attention at what one side feels like relative to the other side, because you might find that this is really easy on this side, and then when you go to do it on the other side, it's not so easy. So anytime you highlight the weaknesses, those are the areas that you want to make sure you go back and repeat again. Once you've completed your 20 repetitions doing your side plank, you turn onto all fours and you go up into a semi-downward dog position, and you start bringing that toe down to the ground. Always in control, not allowing the band to slingshot you back up. Exhaling every time you come down. And this one, you're going to feel it in the core because the muscle that you're working here, the hip flexor, originates in the spine, in the low back region, just below the ribs, and it inserts on the femur or the thigh bone. So when you're moving in this manner, you're going to feel this activate through the core region. After completing your 20 there, you just turn, and these are all just quarter turns, making sure that you're addressing each side of the hip. From here, you can go into a kneeling side plank and bringing that resistance down, always in control. And here you start to feel this one on the inner thigh. If you turn the toe down slightly, you'll feel it again slightly different. We have various inner thigh muscles, more than just one. So based on how your foot is positioned, you will notice that you will activate different portions of that muscle, or of those muscles that allow us to bring our leg towards our midline. If you're more advanced, you can take this exercise up to a arm plank, and you can do it through here. Whatever you feel comfortable with. And then once you've completed your 20, Switch to your next side, and then repeat the sequence on your dominant leg side. Once you've highlighted all your weaknesses, go back and repeat those movements again on, it could be on either or, it could be your left side where you found some weaknesses on the inside, and then on your right side you found them on the outside. Just go back and repeat the ones that you found you were the weakest at. All right.